So let's talk about whether you might be struggling with a problem. Let's throw up the slide on kidney dysfunction symptoms. So I want to talk a little bit about some of the more common symptoms associated with kidney dysfunction. So I mentioned this earlier, and that was swelling of the ankles. So swelling, but again, it doesn't have to be just isolated to your ankles. If your feet get puffy, if your hands get puffy, if your skin gets super puffy, these are all potential reasons or potential symptoms that your kidneys could be improperly excreting fluid. This is why a lot of times you go to the doctor and you're swelling, sometimes they give you what's called a diuretic. And so that's a common treatment, right? A diuretic, because it helps what? It helps to your body, your kidneys, to excrete more water, so it takes that water away and reduces the swelling subsequently. Increased urgency to go to the bathroom. So increased urinary output, increased urinary urgency. This is super common with diabetics, right? One of the hallmark symptoms, of diabetics is increased need to urinate and or excessive urination, and that's because their kidneys are working extra hard to filter out all the glucose. Again, a kidney's a filter, right? So all that sugar floating around in the bloodstream, the kidney's working extra hard, and so you're producing a lot more urine to try to deconcentrate that glucose that's coming out. And so your kidneys work harder in that regard, so you urinate more. So it's a sign that your kidneys are being damaged by glucose, which is one of the predominant things that actually causes kidney disease, is excessive blood sugar or excessive glucose. Additionally, symptoms, blood in the urine. If you've ever had blood in your urine, this is a potential problem. It could indicate a kidney infection, right? So like a bacterial or a fungal infection of the kidneys. It could also indicate a major kidney function issue. Now, I was talking about tests a minute ago, and one of the things I didn't even bring up was a urinalysis, or a UA. And that's another test that's very common that most doctors do. This is, again, where they take a urine sample from you, just a standard urine sample. One of the things they do look for in that is they look for blood. So if you've ever had a test come back where you had blood in the urine, and there was no other discernible reason why that blood might have been there, that could also be a marker for problems in your kidneys. Now, remember we said earlier that your kidneys help maintain electrolyte balance, and that's why this next symptom, which is muscle cramps, can happen, muscle cramping, because with poor electrolyte preservation, the muscles can actually start to cramp. You can get twitching muscles, eyelid twitches, shoulder twitches, involuntary, thigh twitches. Some people get severe cramping that occurs at night or in the daytime, but at night it's kind of a hallmark that can happen at night. So the kidney dysfunction, again, muscle cramping. Now, not all muscle cramping is kidney dysfunction. Sometimes the muscle cramping can be nutritional deficiency. So again, it just depends. This is a symptom potentially of kidney dysfunction, but not an end-all be-all. So additionally, trouble sleeping, not being able to go to sleep, insomnia. This has a lot to do, the insomnia has a lot to do with the not the electrolyte, but the acid-base balance component of what your kidney does to help you function. And then we also get puffy eyes. That's part of the swelling, right? So puffiness around the eyes, itchy, dry skin can also occur. And some of that has to do with the puffing or the swelling of the skin. As you retain more water, the skin is stretched. It can become more dry as a result of that as well, but also because of the dehydration component, that dryness. And then loss of appetite. So reduction in wanting to eat or reduced appetite. So these are kind of hallmark symptoms. If you have everything on this list, you probably need to go have a conversation with your doc about that, because, again, everything on this list could very well indicate that you might have a kidney problem. So again, these tests, ask your doc, creatinine, blood urea nitrogen, GFR, urinalysis are the common ones that they're going to run, but make sure they're running it. I've seen cases where people go in and the doctors won't even run a test. They just kind of give them a medicine. They go in, they have swelling in the extremities, and they're having trouble sleeping, some of the hallmark symptoms. They walk out of the office with a prescription, but no lab work was run. It happens on a pretty frequent basis. You'd be surprised at how often that actually can happen. So my advice would be, if you're going to see your doctor, just ask and inquire about the lab tests. Most doctors, if you ask and inquire, they'll actually run it. It's if you don't, sometimes just because they may be in a hurry or they may not have time today, they just don't run it. And again, I don't think that would be necessarily even be something malicious that they're trying to do. Obviously, that your doctor's not trying to be malicious, but sometimes you just have to ask. Sometimes you just have to prod them in the right direction in order to get them to help you and run testing. So again, a lot of doctors don't like to run a lot of testing. So ask for it, and you'll receive it. Okay, let's talk next. I want to talk a little bit about some things that damage the kidneys. So there are a number of different things that can cause direct damage to the kidneys. Let's make a column over here. And one of them is pain medications, non-steroidal anti-inflammatory medications. So if you're taking ibuprofen, for example, it has to be metabolized out by the kidney. Unlike many other drugs, a lot of drugs are metabolized by your liver. Some drugs are metabolized by your kidney. Some of those include certain types of antibiotics are metabolized by your kidney. Certain types of antifungals are metabolized by your kidney, and non-steroidal anti-inflammatories for pain and inflammation are metabolized by your kidney. So if you've got a history of kidney damage, and you're certain of it, like your doctor's treating you, maybe one doctor's treating you for low kidney function, and then another doctor wants to give you, one of these three types of medicines, always make sure you're aware of that these medicines, if your kidneys are already having a hard time functioning, these medicines can make it even harder and can create an even bigger problem. So don't forget it. Don't forget, write these ones down. So these things can damage your kidney. What else can damage your kidney? A big one is glucose, too much carbohydrate, too much sugar. So I'm going to use this as an example because we've talked in the past about the grain-free, gluten-free diet. And one of the reasons why it works so well in people with kidney disease, we'll talk a little bit more specifically about gluten, but one of the other reasons it works so well is because it's a reduction. If you do it right, you follow no grain, no pain, you do it right, it's a reduction in probably the quantity of carbohydrates that you're getting. One of the sad fundamental facts of our society today is that organizations like the American Heart Association and the Food Guide Pyramid, some of these entities that basically give a one-size-fits-all dietary advice have basically told people to consume 60 to 70% of their total calories from carbs. And what that does is it drives up the breakdown of these carbs. It drives up glucose in the bloodstream. And so, if we look at like the American Heart Disease Association's diet recommendations, we kind of scratch our head and say, no wonder heart disease hasn't been really effectively battled in this country. I mean, it kills 1 million people a year. And despite all the advances in medicine, despite all the medications that are being used, we still have 1 million people a year dying. And a big part of that is their diet recommendation is conducive to causing elevations in glucose. Those elevations in glucose, you have to understand, there's a term called glycation. Now, if you've ever had a hemoglobin A1c test done, that hemoglobin A1c, some people refer to it in short as A1c. What that's doing, hemoglobin is a protein. Hg is abbreviation for hemoglobin. This is a protein that carries oxygen inside your red blood cells. Okay? And so what doctors are doing when they're measuring hemoglobin A1c is they're measuring the quantity of sugar or glucose that is wrapped around that protein. So glucose, basically, it coats that protein, makes it sticky. Okay, that's called glycation. When we have sugar coating something, that's called glycation. And what that does is it makes that red blood cell less effective at carrying oxygen. But glycation doesn't stop at hemoglobin or red blood cells. Glycation can affect your hormones. Glycation can affect the other proteins in your bloodstream. Think of glycation as pouring syrup into your bloodstream directly. So the more glucose you have, the higher the carbohydrate diet you have, the more glucose that hits your bloodstream, the greater level of glycation that occurs, the more disruption of blood proteins we have, the more disruption of hormones that we have, and it creates systemic-wide types of health issues. And that's why so many people are reducing their carbs, right? They're lowering their carbohydrates in their diet, and what are they seeing? They're seeing reversal, not reduction, reversal of diseases like diabetes.
Hey, don't forget to check out the rest of the series right here. Make sure you hit subscribe below, and as always, thanks for tuning in.